So now let's talk about the most important lymph nodes in the body and their importance from exam point of view. Now, before we talk about individual group of lymph nodes, let's talk about why lymph nodes are really important from exam point of view. Now, in exam, lymph nodes will help you to come to a diagnosis, right? It helps to narrow down the differential diagnosis and it helps us to stage the disease. Let's say if there's malignancy, lymph nodes help us in the staging of the malignancy. All right. Now let's talk about diagnosing first. Now, talking about diagnosis, let's say there is a question about an ulceration in the anterior part of the tongue. Now, there are numerous causes of ulceration in anterior tongue. It could be squamous cell carcinoma, it could be Crohn's disease, it could be a simple aphthous ulcer, it could be a viral infection, right? So, how do you distinguish what is the diagnosis based on the examination finding? Now, anterior tongue drains into the submental lymph node. Now, if the submental lymph nodes are involved, and let's say if they are tender, mobile, then we can be pretty sure it's an infective cause. All right, if it's tender and mobile. Now, if that lymph node is hard, fixed, immobile, then we can think about the more sinister cause, right? Then we can think about malignancy. So this is how lymph nodes help us to differentiate between a benign and malignant cause from the examination finding itself, all right? Now, another important feature of lymph nodes is the spread of malignancy, right? If the malignancy spreads, then the lymph nodes will be involved. Now, the most important thing you need to understand that there are something called sentinel lymph nodes. Now, sentinel lymph nodes of different malignancy and different organs are different. But the concept that the lymph node which will be involved first, right? The lymph node which is initially involved when the malignancy spreads is the sentinel lymph node. So let's take example of breast. If the breast cancer spreads, the first lymph node that will be affected is the axillary lymph node. All right. So for breast cancer, the sentinel lymph node are the axillary lymph nodes. So these are also super high yield from exam point of view. Now let's look at individual group of lymph nodes. All right. Now I won't be talking about each and everything in this table. You can pause the video and read the table yourself. But what I'll be teaching you is the clinical importance. So like I talked about earlier, submandibular and submental lymph node, they're important for the diseases of the oral cavity. All right. So I talked about tongue in the earlier slide, right? Now let me give you an importance of the draining lymph nodes from the example of the lips. All right. The lower lip and upper lip, they have slightly different drainage. All right. The upper lip and the lateral part of the lower lip, they drain into the submandibular lymph node. The medial part of the lower lip, it drains into the submental lymph node, all right below the chin. Now, if there is a lesion in the most medial part of the lower lip, you can understand that the submental lymph node will be involved. Whereas if there is a lesion in the lateral part of the lower lip, the submandibular lymph nodes will be involved. This is just an example why lymph nodes are important from exam point of view. It will help you narrow down to the location of the disease, all right? It will help you understand the spread of the cancer, all right? That's why lymph nodes are super high yield. Now, if the deep cervical lymph nodes are enlarged, then you can narrow down that there is some kind of disease either in the posterior tongue, oral cavity, or there is some kind of malignancy of head and neck. All right. So if deep cervical lymph nodes are involved, this is what it hints you towards. Now, like I said earlier, the way lymph node examination help us to narrow down the diagnosis is by its characteristic. All right. If it's an infection, the lymph nodes will be very tender and mobile. So let's take example of infectious mononucleosis. Super high yield from exam point of view. In infectious mononucleosis, if you don't have lymphadenopathy, then it's likely that diagnosis is something else. All right. So infectious mononucleosis, lymphadenopathy must be present. Now, when you examine the cervical lymph nodes, if they're not tender, then your suspicion about infectious mononucleosis is wrong. All right. In infectious mononucleosis, the lymph nodes are going to be tender. All right. But let's say if it's a malignancy, then the lymph nodes will be non-tender, immobile, fixed, hard. All right. So this is how you can distinguish whether it's infectious mononucleosis or it's a malignancy. All right. So another most important lymph node from exam point of view is the left supraclavicular, the Virchow node. All right. And it is involved in abdomen and pelvis malignancy. That's why it's super high yield. Now, another highly tested question in exam is tuberculosis. All right. Now, in tuberculosis, mediastinal and hilar lymph nodes are involved. So whenever you have a patient with cough and hilar lymphadenopathy, you can narrow it down to these causes. All right, you can narrow it down to TB, sarcoidosis, malignancy, and granulomatous condition. Right. So TB and sarcoidosis are the granulomatous conditions. So if there is cough and other respiratory symptoms, and if these mediastinal and hilar lymph nodes are involved, then you can narrow it down to these diseases. All right. We talked about breast cancer, right? And how axillary lymph nodes are involved. Now, another super high yield lymph node is epitrochlear. Whenever you have involvement of epitrochlear lymph node, you can definitely choose the option of syphilis. All right. Super high yield. If epitrochlear lymph nodes are involved, you can narrow it down to syphilis.